All right, everyone. This is our week 4 of our onboarding series. Just to as a reminder, you're going to be meeting with me for a total of 8 weeks, and I just kind of break down training again in little bite-sized pieces. And then we also go over some aesthetic record topics, and then also some general MFL topics as well. And then always at the end, I assign some marketing homework just to kind of help jumpstart you into the world of social media, because so many medical people, we are just not excellent at it. And sometimes we need a little bit of help. So let's get started. All right. So like I said, this is week 4 and this call is being recorded. I will post it up to the Facebook page later this evening, along with the homework on the onboarding Facebook page. So this week, we're going to be talking about an eyebrow lift. We're also going to be going over some microneedling topics. And then for AR, we're going to go over employee discounts and touch-ups. And then we have our marketing ideas / homework, and it's going to be a salon reach out, and you're going to post 2 times on social media. Okay, so let's talk about an eyebrow lift. So an eyebrow lift can be done 1 or 2 times. The first time would be if you are injecting a patient and you notice that they are naturally hooded. So if you look at this patient at the picture up on the left side, you can see that her eyelid is naturally heavy. So whenever I would be injecting this patient, I would probably already go ahead and just pop in an eyebrow lift so I can prevent any heaviness from occurring. This is also something that some patients they want just an eyebrow lift in general, and that's all they're wanting, is just a little bit of lift as well. The second time that you could be potentially doing an eyebrow lift is if the patient does feel super heavy and you might have accidentally caused a little eyebrow ptosis, then you can go ahead and do an eyebrow lift to fix it. Remember, there are 3 ways to fix an eyebrow lift. Those are time, toothbrush, eyebrow lift. So let's go into exactly where you're going to be injecting this. Come on. Well, it wants to open. We'll do it the old-fashioned way. It is, I can't spell video right. I'm trying to find the one that I use. So hold 2 seconds. There we go.
Okay, what I want to show here is the mini brow lift.
Wrong one. Clicked on the wrong one. Sorry about that. I'm sorry that my link is not working. There it is.
Hello, my name's Chris Duncan and I'm a consultant plastic surgeon at the Nuffield Health Tees and York Hospitals. Today we're going to talk about surgery to improve your brow. Patients often come to see us asking for upper blepharoplasty, but on review we find that in fact one of the problems is that their brow position is low, and this creates heaviness around the upper eyelid, and the patients often perceive that what they need to improve that is a blepharoplasty. However, after careful explanation, it's clear that in fact they would benefit from lifting the brow out of the eye, and this has the effect of opening the eye and making it lighter and brighter. This procedure is called a brow lift, and there are a number of different ways that we can perform this surgery. The procedure we do most often is called a transblepharoplasty brow lift. The transblepharoplasty brow lift is done via a single incision.
Nope, not this one either. It's an English guy that does it. Hold, please. I'm so sorry. I'm annoyed that I cannot find my link. It's here we go.
Wix gives you the power of AI to build the website you need. With full.
So Layla expressed to us that she'd noticed these little horizontal lines that for her age are a bit more in your perception than her friends. And this is what is causing those horizontal lines, which is the frontalis muscle. Full name is the occipitofrontalis muscle because it actually comes all the way from the back of the head and reaches around. Although that's kind of interesting, it doesn't really affect what we do mostly. Mostly there are enough adhesions that I think it moves independently. You don't often see the whole scalp moving. We want to relax as much of this muscle as we can without losing the support for the eyebrow. Particularly in a female, if you cause that drop, they're very unhappy. You can actually get away with it with men much more often because firstly, they don't put eyeshadow on. If you ask someone, you'll know this, but for the men watching, if you apply eyeshadow, you instinctively lift your eyebrows to do it. And that's the thing that women complain about. They can actually look okay at neutral. So when you look at them, they don't look like they've got a brow drop, but they're very upset by the fact they can't move their eyebrows. So that really helped me earlier on to realize it's not just about the appearance, it's about the function of the muscle, and to leave some muscle moving as much as you can in most situations. Right next to it, right inferior to it, you have the next muscle we're going to be concerned about, which is the corrugator muscle. Corrugator muscle starts deep on the bone and moves its way as it crosses laterally to insert into the surface of the skin, usually just near the mid-pupil or slightly lateral from it. And you can see the insertion point, which is fibers directly connected with the surface of the skin when someone does a really big frown. Can you see if we can do that for us? Yeah, so this just here is where the insertion point is. Anything lateral to that is not going to make any difference to the frown line, but it does have a chance of affecting the frontalis muscle, particularly if you're a little bit on the deeper side, and that is going to cause asymmetry to your brow. So this is a very important point to know about.
So when he's talking about the fibers, remember in training when I was talking about marking your V's, that is exactly what I was talking about, because you're actually really pointing to where the tip or the tail of those corrugators are so that you are not going to accidentally inject the frontalis muscle. So always please make sure that you're marking your V's for this reason.
We need to be very superficial and low dose here, not just to protect for eyelid ptosis, because the levator pulpary muscle is very close. You can see that on this model here. That's the muscle we worry about with droopy eyelid, but it's actually the frontalis muscle that causes more problems. So if you go too lateral, you get asymmetry to the eyebrows if you've done it on one side and not the other, and you can also get heaviness to the eyebrows. So it's a very important point to isolate, know that you see the insertion point, and then inject. I usually say 5 millimeters medial to that insertion point. A couple of other interesting muscles. So the procerus muscle, which pulls down here, not everyone has a very strong one. So let's see if you can show us your procerus. You can see there's some downward pull. Not particularly strong, I'd say, Layla. Mostly she's pulling in this direction, corrugators with a little downward pull. You certainly don't need to put 7 units into that, which a lot of people do. You could probably do 2 units and you get the same result. Then you have the depressor supercilii, which some people consider just a branch of orbicularis oculi, and it's a slight downward and lateral pull that does this when you frown, if you do a big frown again. And whether it's there or not, it's kind of academic. We're basically treating in the same place as the corrugator. The belly of the corrugator is in the same spot. So if we treat that sufficiently, we'll get those fibers as well. Okay, orbicularis oculi, it has an origin medially and connections with the lateral facial ligaments here. The lateral canthal thickening here is ligamentous attachment to the skin. So when that muscle contracts, it tends to contract respecting where it's attached. So if you think of it, when this normally comes to play when you're treating someone with botulinum toxin is that if you relax the inferior part, the medial part will still pull towards its attachment, and you get this strange pull in some people in this direction. So we need to be aware that it's in a tug of war, but a circular tug of war, and wherever you relax it, you're going to get a pull often in the other direction, particularly with the other muscles. Now, this isn't always a bad thing because we actually use it for eyebrow lifts. If you relax this muscle here, if you close your eyes very tightly, you'll see what happens to eyebrows. Eyebrow gets pulled down. And these muscle fibers here are pulling the eyebrow downwards, which means if we relax them, you're going to get the frontalis muscle unopposed, able to lift slightly more. So this tug of war will be in our favor if we relax here. Here it's not in our favor because we pull medially. The levator pulpary muscle runs all the way to the back of the lobe, and its strongest portion is well within the lobe behind the orbital septum. So the orbital septum is a very thick, if you see it on a cadaver one day, it's really quite a tough structure. It's not that easy for something to permeate through it, which tells me most of the eyelid ptosises are coming through being too deep. You've either gone through the orbital septum, or maybe there's some abnormality with the orbital septum, which is also possible, or maybe even through the little foramen above, because that's how you get into the lobe. So depth is very important, and if you don't do that, you should enjoy many years without getting an eyelid ptosis. So if you could do a big frown for me. Now, just as we're talking about, I'm trying to see where the insertion points are. And you might in the beginning mark that out, because lateral to that is no muscle that we're interested in. Right there is the actual insertion point, but this is probably the safer place to inject, because it just means you're further from the lateral frontalis. I then go to the deepest and strongest part of the muscle. So I'm trying to predict where the strongest part is, and I'd say that's probably there. And then I might do the procerus if you wrinkle up that. So we'll put a little injection in there as well. Then it's basically repeating the same, finding insertion point, a little bit medial to it, finding the heaviest and deepest part. So next thing is the forehead. Forehead is actually the most difficult to mark up, because it's one of the areas where it's most clear that we're in a balancing act, because I need some muscle to move and some muscle to be relaxed, or I won't get a difference. And so most of your follow-ups are forehead follow-ups, because you have too much movement or too little movement, and you're either correcting for a bit of heaviness or you're trying to correct for too much movement and still having lines. But it helps to draw out the box that you know is safe to treat in. And this is my way of describing that. And there are lots of other ways you'll come across. But I like to try and base it on this principle that I want relaxed muscle and working muscle. So lower down, I want a bit of movement, and higher up, I don't want much movement. I also want a trend towards more movement laterally, because she's female. So I'd rather there was more movement here than I wouldn't be the end of the world, but I don't want heaviness at the sides, lifting in the middle. So in terms of preventing heaviness in the brow, it's about 2 centimeters, or in a very small forehead, about 50% of the forehead from the orbit that I leave untreated. So if you were to mark that on approximately using this pencil.
Where does the orbit start?
So good question. You can feel for that. It's very close to the underside of the eyebrow. Okay. So in Layla's case, you can actually feel just where her eyebrow starts is where the orbit is. So 2 centimeters above that should leave enough muscle functioning. I also then follow the contour of the forehead, so it's not a dead straight line. If I start with 2 centimeters here and follow around, that'll give me a good idea of where that safety zone is. Then you can follow this all the way around. So that's an area where, aside from where we're injecting here, which you can box off, we're not going to inject the other areas.
It's a no-go
So that's a broadly speaking, let's call it a higher risk area, not a no-go area, because sometimes you do end up going there. But as a first pass patient, you would probably not treat there. You're looking for areas where there is no muscle movement that you can basically ignore. So it's not a large area, but a little area like that, where there's an aponeurosis. It might go down the middle of the forehead. Some people think it does, some people think it doesn't. But broadly speaking, the muscle does have 2 bellies to it, and in the middle is the weakest. So I tend not to put an injection right in the middle. So I can see this muscle kind of ending here as well. So as this tapers off. So I want to elevate the eyebrows based around where the arch of the eyebrow is. And so what I'm trying to get to happen is I want the muscle fibers that are directly pulling in that direction to be left untreated and as active as possible. And so the way I do that is I draw a line following where the eyebrow arch should be. You can draw a line from the base of the nose through the eye, middle of the eye, and then up here. And you can think of that as a vector. This is the direction that you want the muscle to pull. So once you've got the direction, we then need to figure out how much muscle to leave untreated. Because if you leave muscle untreated that is not part of this vector, you end up with ladder lines. So say this whole area here, lateral, is untreated, then she'll get lines that run all the way up the side of her forehead. So I want it to taper off. I'm trying to leave as little muscle as possible to do the lifting, while most of the lines fade. And the way I've learned to do that over the years is to start with the base of the eyebrows in measurement and choose the same amount each distance apart, which is approximately where that is, where the mid-pupillary line is. And then you can draw a line.
What you call it?
It mainly lateral matters about the medial line, because lateral to this is no muscle. And this becomes another boundary. This is where I don't want to treat. If I want eyebrow lift, maximum, that's a key word. If I want maximum eyebrow lift, which therefore is not super maximum, it's not super high in your case because your forehead is smaller. On a big forehead, you can get ridiculous eyebrow lifts. But I still might soften that, but that's just giving me my first boundary. But the concept here, once you're treating this part of the forehead, is to fill with enough injections that you reduce the strength of the muscle evenly throughout. And so I would normally start right up against the boundary, remembering that each injection actually spreads about 1 to 1.5 centimeters. So if I inject there, it's more like a finger-sized injection. So if I do that all the way along, I won't draw all the circles, but essentially that's what I'm imagining in my mind with these injections, and I can fill the space, and you can fill it any way you want. So let's move on to orbicularis oculi. So this muscle, very superficial under the skin at about 0.2 millimeters. We don't need to be deep. The deeper you go, the more you get the side effects. Side effects, lateral rectus, tear duct, and the one I forgot to mention earlier is the zygomatic muscle. Never seen someone actually get that, but if you go deep straight through the cheek fat, then you hit the origin of the zygomaticus major, and they'll get an asymmetrical smile. Miserable. Okay, so I'm picturing now sort of Ray-Ban shape muscle that splays around the whole eye. And if you ask her to smile, you can often see the contraction of that bulge here. So that's actually where my most effective injections will go. I usually start tailor the eyebrow, pretty safe place to start. Actually gets more complex as you go inferior, lateral canthus, and then just near the cheek, near the lateral lid cheek junction. And then I'll do a couple of minor doses here. I sense check everything and just check that it looks broadly symmetrical and you haven't calculated something incorrectly. Just like with your, remember GCSE maths, my teacher always would say, now look at the number and say, does it actually make sense?
Yeah. Yeah.
And it's a bit like that.
All right, so that is a basic kind of eyebrow lift. The easiest way is just that whenever you're injecting the frontalis muscle, that you are not injecting directly above kind of like the peak of the eyebrow. You really want to try to leave that frontalis muscle unopposed, because normally the frontalis muscle is responsible for elevating the eyebrows. When you put neurotoxin into the frontalis muscle, it becomes a depressor muscle group. The orbicularis oculi is normally a depressor muscle group. So when I put neurotoxin into it, it's going to become an elevator. That's why by treating orbicularis oculi and at the tail or about 1 centimeter in from the eyebrow, that is what will help lift the eyebrows up. Any questions on an eyebrow lift or how to kind of prevent either ptosis or how the frontalis muscle interacts with orbicularis oculi? So any questions based off of that? No? Excellent. Moving on. Let's talk about microneedling. So we talked about microneedling in training and just kind of really brush the basics of microneedling and all the different benefits of it. So the big thing that you want to know is that whenever you are microneedling your patients, the purpose is to kind of bring blood back up to the surface of the skin. So we create little micro channels all over the skin so we can create blood flow, because blood brings oxygen and blood is healing. It can help with acne scars. It can help with skin discolorations. It can help with skin texture, a whole slew of things. I typically recommend that my patients do microneedling about once a quarter or so. So whenever you're microneedling, we have two different serums that we use at MFL. The first one is going to be the liquid gold, and the second one is going to be the glow. The glow is our baseline serum. It consists of hyaluronic acid, vitamin C, and vitamin B12. Then we have the liquid gold, which has all three of those ingredients plus two additional ones. We actually put neurotoxin into it because the neurotoxin helps decrease pore size. And then we also put in Sculptra. Sculptra is kind of a filler-like product that's underneath the umbrella of fillers. But really what it does is it is a collagen-producing filler that helps lay different seeds down. So it makes your body produce its own natural collagen. So we put that in the liquid gold as well. So when you're looking at the different layers of the skin, you do want to make sure that you are in the appropriate layer. So when you are looking at the epidermis means on top. So the very top layer of the skin. When you're microneedling, you want to either be between the epidermis and the dermis. You do not want to be in that third layer of the skin, which is that kind of sub-Q area. So in order to do that, you want to make sure that your microneedle needle is going anywhere between the 0.2 all the way down to that 2.5. Anything below 2.5, you're really getting into that subQ tissue area, and it's really, really painful for the patient. So for our MD needle pen that we use, it goes from 0.25 all the way down to 2.5. So just make sure that you're not trying to, press really hard whenever you're at that 2.5, and you're just doing that kind of light, gentle pressure, just like you're drawing with a pen. You also need to know that microneedling is safe on all 6 of the Fitzpatrick skincare types. Just make sure that if the patient does have a history of keloids or does have a keloid scar, that you are not going over that. Here are some other things to think about right before you're microneedling your patient. You need to make sure that the patient has not been on Accutane for the past 6 months. Obviously, if they're pregnant or breastfeeding, keloids are a no-go. You do want to make sure that they're not doing any waxing or anything like that right before you've done your microneedling. And then sunscreen is going to be very, very important afterwards. You also need to tell your patient that they do not need to put anything on their face for the next 24 hours. So no makeup for 24 hours. You do want to make sure that all those little micro kind of channels that you just created, that they do have a chance to heal up and we're not introducing any type of bacteria. And then no working out or so for the next 24 hours as well. Any questions on microneedling? Great. And you can actually start microneedling now. You can do it at your launch party. You can do it obviously anytime during your probationary period. So microneedling and the chemical peels are a go for you as far as the different things that you can do for your patients. Okay. Let's talk about employee discounts. So employees receive 55% off of your own personal treatments. Please make sure that you charge yourself an appointment fee every single time. I know it sounds silly, but the way that we do our payroll, you have to charge yourself an appointment fee. So please charge the $12.50 appointment fee for any personal injections. You are more than welcome to inject yourself if you feel comfortable. If you do not feel comfortable, you can get another MFL injector who's in the area, and y'all can get together and you can inject each other. Okay, let's talk about the difference between an enhancement versus a finesse. So a enhancement is going to be like, let's say you're doing someone's glabella and the patient is saying, oh, I'm on a budget and I don't want to do 20 units of Botox. I only want to do 12 units of Botox just because of my budget. So that's excellent. We're going to go ahead and we are going to inject the 12 units of Botox because that's what the patient's budget can afford at the time. You will educate your patient and let them know that they will still have some movement because they are not doing the full dosing. You will chart that in their chart. Let's say that patient comes back to you 2 or 3 weeks later and says they still have movement and they would like more product. At that point, the patient would have to pay for the additional units because they just need more. A finesse treatment is a little different. That's going to be totally free to the patient. And that's for Botox, it's going to be up to 4 units. And same with Juvo. And for Dysport, it's going to be up to 10 units. This is for, I still have a little bit of movement. I might have a small spot eye. Maybe I have a little bit of a brow ptosis. So we kind of give you a little bit of a wiggle room with that. And the patient is not charged for the finesse follow-up. So that's the difference between an enhancement versus a finesse. Are there any questions with this? Great. All right, let's talk about our marketing for this week. This week, you are going to start reaching out to some salons. So we have several salon partnerships, and it can be an esthetician's office. It can be a primary care office, a dental office, any type of office that does not offer neurotoxin or any of the service that we offer, we can actually partner with them. And how this works is we will actually pay the salon owner for their time of us renting out their chair or room for that time period. If you do have a salon that is interested in partnering with us, please reach out to Ashley and she can get you the contract and she will communicate with the salon owner so we can get them up and running. This week, you're going to post a before and after of an eyebrow lift, and I actually have that graphic for you, and you're going to say it's under $50, which is great. So if you do, you can do like 2 units of Dysport, or I'm sorry, 2 units of Botox or Juvo, or that's going to be 5 units of Dysport, so 2.5 and 2.5, If the patient does not use the coupon, it's going to be under $50. If they do use the Jeuveau coupon, it would be significantly cheaper. But I have that graphic for you, so you can go ahead and post it. And just a reminder, MFL does accept all of the major patient reward programs from all the major neurotoxins, meaning Botox, Dysport, and Jeuveau. And then you're also going to post this week one time of an education post on microneedling and the benefits of it. This is going to be a post that you are going to create yourself. So you're going to post 2 times on social media, and you're going to start reaching out to salons. Now, at this point, I know several of y'all have already had your launch party, and I think there's a handful of people coming up this next week for your launch parties. We did have a new group join us for our calls, and they are some of the girls that have taken the oral exam, and so they're kind of catching up on all of the different calls that we've done, and so they're going to be planning their launch parties over the next couple of weeks as well. We do want you to continue your social media following to make sure that you're getting all the different education things and using social media to expand your aesthetic knowledge. So this week you're going to follow, it's Ninja Injector and then Aesthetic Injector Tani. So these 2 different pages, they do a lot of education and a lot of advanced neurotoxin and filler things. And so we do want to make sure that you're adding as many tools to your tool belt as possible. The aesthetic world is constantly changing, and it's great to see people teaching and learning. And this is really how we become the best aesthetic injector. So that is going to be it for this week. I am going to review some questions. So if you can, please unmute yourself and let me ask these questions. All right. How do you reconstitute Botox, Dysport, and Jeuveau? Botox and Jeuveau are both what?
2.5.
0.5. And Dysport is what?
3.
Excellent. On label FDA is 1.5 and 2.5, but MFL, we reconstitute Dysport with either 1.5 or 3. True or false, botulism toxin produces paralysis by blocking the presynaptic release of acetylcholine at the neuromuscular junction. True or false?
True.
Name the muscles that make up the glabella complex.
Procerus and the corrugators.
Very good. Next question. How long is it recommended for a patient to wait before getting a neurotoxin touch-up? How many days?
14.
14 days. Name one way that you can treat a brow ptosis. We told you 3 in training. Time, toothbrush, and what?
Brow lift.
Brow lift. Very good. Number 6. What allergy would be concerning for a patient receiving Dysport?
Cow's milk.
Cow's milk protein. When selecting dermal filler for a patient, explain G prime as it relates to filler rheology. Basically, G prime is what?
How thick it is.
Yep. The very good. The higher the G prime, the thicker the product. What is the name of the enzyme used to dissolve dermal filler?
Hydrolonely.
Hyaluronidase or Hylenex. Very good. Who did not receive neurotoxin? Pregnant or breastfeeding women, a history of allergy to neurotoxin, a history of neuromuscular conditions such as MS, or all of the above?
All of the above.
All of the above. What are the lines called that are etched into the skin due to constant movement and can be seen at rest? Static or dynamic lines?
Static.
Static. On average, when will neurotoxin begin to break down after injection? This is asking, when does that SNAP-25 slowly start to grow back? And the answer is 6 to 8 weeks. I'm actually just right at 6 weeks right now. I'm starting to get some movement. What muscle turns the frown upside down when injected with neurotoxin in the lower face? Is it the DLI, risorius, abicularis oris, or the depressor anguli oris, also known as the DAO?
DAO.
DAO. What is the standard dosing for crow's feet using Botox and Dysport? Botox is going to be 2-2-2, so 6 per side. Dysport's going to be 5-5-5, so 15 per side. Obviously, you can either dose up or dose down, but that's usually kind of baseline where people kind of start, and you can gauge it up or down from there. Explain how you would treat a Spock eye. A Spock eye is where there's a part of the frontalis that is still being active, and so the best way to treat a Spock eye would be to what?
Treat the frontalis on the lateral side.
Very good. Name 3 characteristics that you would see with a vascular occlusion. Let's go over all 5 phases. Phase 1 is going to be blanching. Phase 2 is going to be that reticular kind of lacy pattern. Phase 3 is going to be vesicles. Phase 4 is skin breakdown. Phase 5 is full thickness necrosis. Each phase takes about 24 hours or so to go through, more or less. What major blood vessel branches to the angular artery as it travels to the upper face? This is asking what is the major blood vessel of the face, and it is what artery?
Facial artery.
Facial artery. What medication and dosage is prescribed prophylactically for a patient with a history of cold sores, wanting to receive lip filler or a lip flip? Valtrax, 2 grams, PO
I'll try.
times 1. Very good. What is the name of the muscle you want to avoid when you are injecting the masseters? And that is going to be the risorius muscle. And then the final question is, what is the standard dosing to treat masseters with Botox? And you're going to start with 20 units per side. When you are injecting the masseters, remember it has 2 compartments. It has a deep compartment and a superficial compartment. You do need to use the longer 1-inch needle so you can hit both compartments. I usually just do the 1 injection technique, but you will see online people can do either the 1 injection, the 3, or the 4. Whatever you are injecting, I go all the way down. I do half of my units very deep, and then I pull my needle halfway out and do the other half very superficial. That way I'm hitting both compartments. If you do not hit both compartments and you don't hit the deep one, what will happen is that bottom compartment will actually jet out and it will look like a little bean sticking out. So it is important that you hit both. And those are all the questions for this week. I keep going over it and over again because that's how my brain learns. I need to constantly hear it over and over again. Then by the end of this 8 weeks, you'll be like, yes, I definitely know all this material and I am good to go. So that is this week. Does anyone have any questions, comments, concerns? Anyone have a launch party coming up this weekend? Nope. Has everyone already had their launch party? Danielle, I don't think you've had yours yet. I think you just recently passed the oral exam.
Yeah, I have not had mine yet.
Perfect. Nicole, have you had yours?
No, I've been talking to some people about getting a launch party together. She sounds like she has a large group she can get, but it probably won't be till closer to the end of the month, which is kind of disappointing for me because I'd like to really do it sooner. But
yeah, understand. Well, just keep reaching out and make sure that you over invite for it, because things always come up last minute for people because that's just the way that the world is.
sure.
All right, ladies, well, y'all
do the 22nd.
I'm so sorry.
This is Sandy. I want to do the 22nd. I didn't know who to tell or what kind of materials to pass around.
Say that one more time. I'm sorry, you cut out.
Didn't know what kind of advertisement materials I could get a hold of to pass around.
Yep. So we don't actually supply any things for you. We do have some little cards that I think they're salon flyers that you can request. But as far as for your launch party or anything like that, everything is kind of word of mouth and you can do some social media posts. So the company doesn't provide any materials for the injectors launch parties. So we always recommend that you start reaching out one-on-one, word of mouth, social media, going out to salon contracts, kind of use your warm market for your launch party.
Gotcha.
All right. Well, I hope y'all have a good rest of your evening and I will see you all next week. It will be on Sunday of next week. The reason why we didn't do it yesterday because it was Memorial Day. We wanted to give y'all time with your family and friends. And so I will see everyone next Sunday at 7 p.m. Bye, ladies.
Thank you.
Thank you.